So you're preparing for the RCA, maybe you're finding clinical management particularly challenging. Welcome back to the channel. If you're new here, my name is Dr. Erwin Kwun. I am on a mission to help doctors lead a happier and more fulfilling life. In this video, I'm going to share with you some tips how you can improve clinical management and score well for the RCA. Clinical management is a domain that many registrars struggle, and there are many reasons why registrars fail in clinical management. A common pitfall is not allocating enough time for clinical management. If you think about it, clinical management is a very important part of the consultation because this is where you're applying your skills to improve the life of your patient. So if you don't give yourself enough time, then you're going to rush your plan and you might miss some elements in clinical management. The other reason why a lot of registrars struggle with clinical management is that they procrastinate clinical management and they don't make a working diagnosis. By not making a working diagnosis, it's difficult to have a clear plan for your management. So if you don't know what you're managing, then the examiner has no clue what you're trying to manage. This is why verbalizing your working diagnosis is very important, because it's a turning point in the consultation to signpost you that you're now in clinical management and you need to go through the steps in clinical management. What are the steps for clinical management? The first step is making a working diagnosis and explaining this to your patient. It's very important that you make sure that you and the patient are on the same page, because if you don't have a shared understanding, then it's difficult for you to have a shared management with your patient. By making sure that you have a shared understanding, that both you and the patient understand what's the problem and what's the working diagnosis, then it's more easy to go through the consultation and discuss the management plan. So once you have shared understanding about the working diagnosis with your patient and you've addressed the concern about what they thought it could be, then you can proceed by discussing the treatment plan. Most registrars know that they need to ask about patient's expectation in the first half of the consultation. But then when it comes to discussing clinical management, this is something that's often forgotten. So make sure that you address the patient's expectation. If it's an unrealistic expectation, then you need to explain to your patient why you don't think such request is indicated. Oftentimes the reason the patient is making a request is because they have another reason behind it. For example, the patient who is worried about his back is asking for an MRI of the back. If you actually explain to the patient about the reason why an MRI might not be useful and it's not indicated, then you may be able to reassure your patient and help them by suggesting something that's more reasonable. So this would help move the consultation forward and addressing the patient's expectation. Discuss the treatment plan by encouraging your patient to get involved in the discussion. Ask the patient about which preference they've got and tie back the ideas concerning expectation that the patient had. For example, if a patient said to you that they wanted strong pain relief, then you can tie this back in your clinical management. Understand that when you came, you wanted to discuss about what pain relief you could have for this pain that you've got. So then you can discuss about the options of different pain relief. So for example, if you're going to discuss about cocodamol, then it's very important to discuss the pros and cons, what are the side effects, inform the patient about the possible side effect and what to look out for. Once you've discussed the pros and cons, then the patient can make an informed decision. If you're going to offer a patient prescription for an antibiotic, it's very important that you verbalize what antibiotic you're going to prescribe. Because if you don't do so, then the examiner has no idea which antibiotic you're prescribing, whether you're prescribing safely, and it's important for the patient as well to know what they're getting and how are they supposed to be taking it. If you're prescribing chloramphenicol eye drop for a patient, then it's important that you discuss the drop, how to take it. If you're prescribing ciprofloxacin to a patient, then it's very important that you verbalize what you're prescribing and whether it's within the local guidance, because by mentioning that, you also show to the examiner that you're prescribing safely, and it's also important for the patient to know that you're prescribing according to the guidance. It's important that you discuss the side effect of medication you're prescribing, because if you don't discuss this, then the patient doesn't really know what to expect. If you're prescribing an antibiotic, it's good practice to inform the patient that if the antibiotic is working in the next 2 to 3 days, you're expecting an improvement. And what do they need to do if there's no improvement or if things are getting worse? Be very specific when you're describing and explaining to your patient. If you decide that the patient needs to be referred to a specialist, it's very important that you specify which specialty you're referring to and the urgency of the referral, whether it's a 2-week wait referral, an urgent referral, or routine referral. Because if you don't specify this, then the examiner has no idea how urgent you're treating this, and they don't really know to which specialty you're referring to and whether this is appropriate. That's why it's very important that you verbalize and justify what you're doing in clinical management. It also is helpful for the patient to understand your thought process as to why you think this is important. For example, if you're referring a patient for an endoscopy, it's very important to discuss about an endoscopy procedure, because this might be the first time that the patient is hearing this, or they might not expect that you're referring them. So that's why it's very important to make your plan in partnership with your patient and discuss what the endoscopy involves briefly so that the patient gets an idea. You may want to discuss about bowel preparation if needed, and what are the things that the endoscopy would entail, whether they are going to be awake or whether they are going to have to take medication. These are things to cover in your explanation. A common mistake that registrars make with safety netting is that they give generic safety net advice. For example, if symptoms worsen, to come back to the surgery. This is very vague and the patient might not know what are the signs or symptoms to look out for. And it's very important to explain to the patient how to reconsult, whether they need to call back the surgery, and what if the surgery is shut. Do they need to call a different service, 111 or calling 999? The patient is left confused, not knowing exactly about when to reconsult and how to go about reconsulting the doctor. Another aspect of clinical management is to arrange a follow-up if needed. By arranging a follow-up, you need to explain to the patient when you expect to see them, and if so, then how is this going to happen? Whether the patient needs to book for an appointment in 2 weeks' time, or whether you're going to arrange the follow-up appointment yourself to reconsult with the patient. By specifying the number of weeks that you'd like to see a patient and explaining how this follow-up is going to happen, then you're making a clear plan that's helpful to the patient. If you've enjoyed this video, then I've got another video where I'm sure you're going to learn a lot from. This is a video where I discuss how you can compress data gathering so that you give yourself more time in clinical management. Click the video here to watch it. Take care everybody. Bye bye.